Well,
When
yeah,
are we proceeding with the
We are
government
live.
meter?
yeah.
Okay, now we are live. Over to you, Kiran.
Thank you. Welcome to the today's 76th podcast of Fogsi. And before we begin, it's an honor to recognize the visionary leadership of Dr. Sunita Tandulwadkar, President of Fogsi, whose passion for women's health is marked by a drive to innovate. With her at the helm of Fogsi, it's not just a federation, it is a movement that dares to think differently, speak boldly, and reach people in ways that truly resonate in everybody's heart, mind, and soul. I salute her innate ability of creating great leadership, great team, and acknowledge each and every members with the kind, appreciative words, and which is the true fuel for our work. Dr. Sunita is HOD and Chief of IVF and Endoscopy Center
Kiran,
at
it is a day, your day with Alok ji. No need to introduce me so further. And I'm so thankful to your kind words, Kiran. Words of appreciation are usually rare. You use it generously. Dr. Alok
No,
Sharma, welcome to the platform of Foxy.
Thank you
Probably
so much.
Kiran was not aware that we are old friends because we have only one common interest, and that's the stem cells. And first time we both met, I think 10 years ago, sir,
Yeah,
when
that's right.
we were in
Yeah,
Dubai to
you were
receive
right.
the award.
Yeah, that's right.
We both were receiving the award, I think Dubai only, right,
That was
sir?
Dubai. Yeah, we met in Dubai.
And then we grew together, being the founders of regenerative medicine. His passion on stem cells is, I was listening and hearing for ages. And the common interest always drive. But definitely, Kiran, thank you for making us meet on this background and taking a autism, very, very important topic where people are not aware that there is no treatment in allopathy. There is no treatment in Ayurveda or homeopathy. So it's a better we just make it, popularize, at least try something else. And with Dr. Sharma, with his years of decades of experience, I'm sure everyone around there will be benefited. To let you know, sir, I have amazing results with autism and I'm quite satisfied. Only thing is, you being a neurosurgeon, probably the volume you must be having more. And it will be wonderful to hear you. Our protocol is I go on a viewer's link, sir, and you and Kiran will be together and having a dialogue, and we all will be listening from the viewer's link. Thank you once again for coming and taking out your time
Thank you,
for
Sunita.
Foxy.
It's such a privilege and a pleasure, to share thoughts with you and all our colleagues. Thank you so much for having me over. Yeah.
Thank you. Yeah, Kiran, you would like to introduce Dr. Alok?
yeah. So, Dr. Alok Sharma, he is Director of Neurogen Center at Brain and the Spine Institute and also Director of KLS Welcome Institute at Navi Mumbai, India. He is a retired professor and head of the department of LTMG Hospital and LTM Hospital, Sion, Mumbai. He is presently a founder president of Society of Regenerative Sciences, ISRS. He is incoming president of International Association of Neurorestaurology, and he has more than 156 publications. And landmark publication has been world's first publication on cell therapy in autism spectrum disorder and world's first publication on cell therapy in intellectual disabilities. He has authored 27 books and contributed 21 chapters to international and national books. and his awards are many. Internationally, the Rose of Paracelsus Award 2016 by Oxford, UK, European Award of Best Practices, Brussels, Europe 2018, Bharat Gaurav Award, which is received at the House of Commons in British Parliament in London, UK 2019, Dr. Julius Vine Dude Award at Boston in 2022, Newton University Legendary Award in June 22, again at Boston, Sino-Phil Asia Pacific Award at Manila, Philippines in 2023, Nelson Mandela Leadership Award in Oxford 2023. And besides that, he also had many important national awards like Sushruth Award and the Times Health Excellence Award, Superhero Autism Award in 2021, Shushruta Award again in 2024, and Champions of Change Maharashtra Award in February 2024, very recently. The areas of special interest are regenerative medicine for incurable neurological disorders and anti-aging. So today we will be talking about the autism and or the autism spectrum disorder, which is called now these days, which affects the millions globally. And what comes to our mind when we hear the word? Is it a label, a challenge, a mystery, or what it is? So today is the time to explore the reality. And for that is our guest, Dr. Alok Sharma.
Thank you,
Well,
Kiran.
WHO, thank you. WHO says just two words that it affects 1 in 100 children globally. Of course, you know better. And in the United States, I was surprised to know that CDC reports it is closer to 1 in 36. It is a illness or it is their different ability to experience the world in a different way. Well, this is all we have to explore. So, sir, with this, I will start my first
Thank you,
question.
Kiran. Thank you, Kiran. And thank you, Alokji. I'll join
Sunita ji,
furiously.
before you go, I just want to say something. More than talk about autism, more than talk about my treatment, for me, this is a very important forum because, as you will see in the talk, the role of gynecologists in preventing autism is huge and big. And when we look at the causes, you will realize that with a little awareness, with a little understanding, gynecologists and obstetricians are the only people who can actually bring down the incidence of autism. And
Agree
at
to
the end
me.
of my talk, I'm going to highlight what are the things. And Sunita ji, my request is if you can set up a committee or a subcommittee to look into this and frame some guidelines, because it is just lack of awareness of some simple factors that is leading to a very big increase. So it'd
Totally
be great
understand,
if you
sir.
can
We'll do
actually
that.
do that. Yeah, thank you.
And my one project is all on preconceptional only.
Oh,
Screening for thalassemia, preconceptional, folic acid, micronutrient deficiency, automatically it will all get covered.
absolutely.
Definitely, Alokji, wonderful, and we'll catch up sometimes.
Thank you.
Thank you, madam. So let's start, as you were saying, and Dr. Sunita, and you were discussing about autism, and you're working so much. I think for the general public, because this podcast is not only for obstetrician gynecologists, also for everyone, because it will be uploaded on the YouTube, so anybody can hear. So let's first understand what is autism. How do we explain it? And doctors specifically, they want to know what happens neurologically into the brain of these children. How do they develop this?
So, autism, as is known, is a neurodevelopmental disorder. That means there are things happening in a developing brain that lead to the symptoms of autism. It has been described fairly recently, as recently as 1943. It affects boys 4 times more than girls. And the main symptoms in this can be broadly divided into three. There are problems in communication or speech, there are certain behavioral or social issues, and there are some repetitive behaviors. But all of these result in the children not being independent. They need to be looked after, especially they can't be part of the normal education system. And that makes them completely dependent on the families and therapists. Like we discussed, just before, the incidence of autism, like you mentioned, is increasing dramatically and very significantly. And up to now, there was no medical treatment that could either cure or even limit the problems of autism. There were some symptomatic treatments that we could give for hyperactivity, etc., but nothing that we could say that the autism could be handled on a more definitive basis. But now there are treatments available. Uh, but before that, the second part of your question was what is happening in the brains of children with autism. So here I'd like to share with you that, at our institute, we do what is called a 360-degree looking at every aspect of what is happening to the child with autism. It starts first with brain scans, and we do what is called a PET CT scan of the brain. And in this, we are able to show which parts of the brain are working less, which are hypometabolic. But we interestingly have also found that there are some parts of the brain that are working more. We then also do an MRI scan, where again, we've had some very interesting findings, where we find that the bridge between the two parts of the brain, called the corpus callosum, is smaller in size in these people. And all of this has been published in scientific papers, and we were the first to publish this. You'll be actually surprised that despite the very high incidence of autism, in conventional practice, nobody is even looking at the brains of these kids. Nobody is doing these scans. It's almost like, if you had an ovarian cyst, not doing an ultrasound to see, how big it is or what it is like. So nowhere in the world was anybody looking at the brain. And we were among the first to not just look at the brain, but even publish all our results showing which parts of the brain are working less and why these children have these symptoms. So in the brain, basically, there are parts that are hypometabolic, and what we have found is some parts like the cerebellum, the mesial temporal areas, the amygdala, the hippocampus, these are the areas that are working less than normal. But there are also some areas in the parieto occipital area that are working more. In the brain, the problem is that of connectivity of neurons. The problem is that at the synapse level, the problem is there of neuroinflammation. There is a problem within the mitochondria of the cell. There are problems in the methylation process. So, and then of course, there are problems with the immune system. So this combination leads to uh, parts of the brain working less, and that is what then leads to the symptoms.
So, very interesting, like how, I mean, you have analyzed this. So, what are the causes is like of this methylation is not good, or the communication synapses are affected, or the some parts are hypometabolic? Are there specifically reasons known to us, or
There
there is?
actually, sorry, yeah. So
Yeah,
there's
yeah.
several reasons, actually, many reasons. And in a particular child, we may not know exactly what it may be. So the reasons uh, are very wide ranging. They start from, when, when the child is still in the womb, to what happens during the birth process, to what happens later. So here we are finding that the entire series, the before, during, and after birth process is very important. And that's where the role of gynecologists actually comes in. Now, our studies are showing that, we've actually seen that about 50%, little more than 50% of, so we've treated so far more than 5,000 children with autism. And when we go into the history, more than 50% have some history of difficulty during the birth process, hypoxia, premature admission into NICU, jaundice. I mean, there is some very definite, cord around the neck, difficult labor. So more than 50% of our children with autism are actually, giving us a history of this. So this is something that is very, very important. We are also finding that the mother's health during pregnancy. So we had one of our colleagues in Bangalore actually did a study on 3,000 mothers of children with autism and found that the incidence of very severe anxiety, emotional depression, emotional stress was extremely high as compared to mothers who did not have children with autism. In fact, his data showed that a significant amount of the mothers had contemplated suicide, not attempted, contemplated suicide. And in fact, he coined a very interesting slogan, which I think, should be popularized. And his slogan was to fathers, if you don't want to have children with autism, treat your wives well during pregnancy, keep them happy during pregnancy. So we keep talking of physical health. We don't realize that emotional health is extremely important because today life has become difficult. There women have to work, they have to look after home, there are emotional pressures, family pressures, society, financial pressures. So the attention to health during pregnancy, in particular emotional health, is not as much. Then again, diet, the food that we eat is very, very important because today we have shifted from home-based eating to eating outside. And we know that processed foods and fast foods do have, chemicals, and they've got heavy metals sometimes that can affect pregnancy. The other
And
interesting thing,
yeah,
but
here comes, I mean, the a question comes to my mind. In Indian culture, as you are rightly saying, we give a lot of importance to the diet. In fact, previously it was said that the diet is most important, and but again, the now science is researching and coming out the role of gut onto everything. It is skin health, dental health, physical health, brain health, most specifically. So, like as you were saying about it, can we have that gut microbiomes? Do they have the role into this
absolutely.
autism also?
Absolutely. So we do a gut microbiome test of all our children, and we are finding a very high infection rate of, bacterial such as E. coli, a very high rate of fungal infections, protozoal infections, much higher than what we would find in routine non-autistic children. So this, the high rate of infection also results in what we call a leaky gut. And when you have a leaky gut, what happens is that toxins and lipopolysaccharides, they get absorbed from the gut and go to the brain and cause neuroinflammation. So the gut, we believe, has an extremely important role to play in the whole autism process. And so part of our treatment is to fix that as well.
So, is it that gut microbe changes are found into the child itself
Yes,
also? You
absolutely. Yeah, we evaluate the child, and we are finding that the children's gut is completely imbalanced, exceedingly high rate. So I was referring to children, not the mothers. I was referring to the children have a very imbalanced gut with a very high incidence of various infections. But from a mother's point of view, yes, the health is extremely important. The diet is extremely important. But it's not just physical health, emotional health is also very, very important. We are also finding that, I mean, there are some papers that show that increased use of mobile phones during pregnancy because mobile phones also over a short distance have some radiation. And there are papers that show that when the fetus is exposed to radiation from the mobile phones, there's a disruption of the blood-brain barrier in the developing fetus. As you know, the blood-brain barrier is something nature has given the body to protect the brain from anything that is not good from the brain, from the blood. So no other organ has a protection system, but the brain has one. So it's called the blood-brain barrier. And excessive radiation from mobile phones can damage that, and that could be one possible cause as well.
Very important information, very important, because these days the screen time is increasing. Whatever the research is coming, still the youngsters and everyone is using more and more. I don't
Absolutely.
know how to decrease it, but at least they should know it. In pregnancy, they should take care of this.
Absolutely. Yeah.
So I read an article which was published into the journal Cell 2021, and there it was said they studied a systematic study of various studies were together. They were studies, and they analyzed the role of folic acid into the this autism issue. And there was a one, although most of the studies showed the positive result into the neurodevelopment of the neurodevelopmental process, but there were one study which was showing the conflicting result also, that folic acid might be responsible for the autism. So I mean, is it really, what do you think about it?
Kiranji, this has got to be the most important question you've asked me, and I'd like to devote some time and attention to this. So, I'll take a little time to explain this. See,
Yes.
folic acid was started as a supplementation. The WHO gave guidelines in 1998. All right. Now, this was meant to prevent neural tube defects like spina bifida, etc. And it really worked, because I remember when I was a neurosurgery resident and a student in the late 1980s and beginning 90s, we had a very high incidence of neural tube defects. I mean, there was not a single week where we would not have one or two patients operated. In today's time, you don't see a neural tube defect for months and years. So the
Yes.
folic acid supplementation by all our gynecology colleagues has really brought down the incidence of neural tube defects. However, it has resulted in some collateral damage, and I'll explain that to you. What has happened is what the WHO had said, and the dose they had advised zero point 0.4 milligram, zero point 0.4 milligram of folic acid to be given in the first trimester only. Why? Because if there is going to be a neural tube defect, it happens in the first month. After the first trimester, you cannot have a neural tube defect. Now, they had advised 5 milligram for women who are at high risk. Like suppose somebody in the family had a neural tube defect, or if the previous pregnancy had it, they advised 5 milligram. What has happened now, I believe, is that many of our gynecology colleagues are using the 5 milligram as a regular coverage. This is actually the dose for infertility. I understand in infertility, 5 milligram of folic acid is given. But this is not the WHO recommendation. The WHO is zero point 0.4. Okay. And we are now, many gynecologists are giving 5 milligram, and they're giving it throughout the pregnancy. All right. Now,
Yeah.
so this is one part. Second, I want to just explain. It's actually very complicated. I'll try to make it as simple as possible. See, folic acid comes to us in a synthetic inactive form. So the way we get it from supplements, the way we get it from fortified food, it is in a synthesized form which the body cannot absorb. So that is folic acid. The folic acid has to convert in our body into something called 5-MTHF. It's a technical word, 5-methyl tetrahydrofolate. So I'll just call it MTHF. Or I'll just call it methyl folate. So folic acid has to convert into methyl folate for it to be absorbed. Our brain only absorbs it as methyl folate. Our brain cannot absorb folic acid. None of the tissues in our body can absorb folic acid. So we take it as folic acid, our body absorbs it as methyl folate. Now, there is an enzyme that converts folic acid to methyl folate. Okay, and this is called, of course, there are actually two enzymes. One of them is MTHFR, which is again methyl tetrahydrofolate reductase. I won't use the names, I'll just call it MTHFR. Now, in 40% of our population, 40% of the regular population, this gene is defective, which means our body is not able to convert folic acid into methylfolate. Our own work, and we've been doing research on this, we are finding that almost all the mothers coming to us, when we evaluate them, their folic acid levels are high. They are high because one, they are getting supplementation more than the WHO recommended dose. Two, they are getting it for longer. And third, they are getting it in the inactive form. Now, in the 60%, who don't have this gene defect, the folic acid is getting converted to methylfolate, right? But in those 40%, it is not happening. And because it is not happening, uh, in the body, there is accumulation of something called UNFA, which is unmetabolized folic acid. So it's unmetabolized folic acid that goes up. Now, this then affects the child as well, because now the child is subjected, when the child is in the womb, there are these elevated levels of folic acid that the fetus is subject to, which can then result in there's a complex series of things, because now and we, again, part of our research, out of 5,000 patients, we have found 73% of our children, 73% of autism children we've treated have the gene mutation. That means they also cannot convert folic acid to folate. And so we found elevated levels of folic acid in the children as well. Okay. So something which is good, but if it is used in an extra dose, and if it is used for a longer period, and if it is used in an inactive form, can actually do damage. There was a paper from John Hopkins. There was a study, an amazing study, from a prospective study from 1998 to 2012, where they actually checked the levels of folic acid in the mothers, and they followed up in pregnant mothers, and they followed up the children till about 3-4 years when autism is diagnosed. And they showed very clearly that elevated folic acid in the mothers is a principal, important, and significant cause of development of autism, because now in these children, the folic acid is high, but the form in which the body absorbs it, that is not available. So there is a solution for this. You also get, folic acid in an active form. So in a methylfolate form. So you don't have to give it as folic acid. You can give it as methylfolate. So our suggestion to our gynecology colleagues is that in an ideal case, the mother's gene should be tested, the MTHFR, but that may be difficult. So a good solution is, one, to, instead of giving inactive synthetic folic acid, to give methylfolate. I'm seeing a lot of gynecologists have already shifted. When because when children come to us, we see what they have been prescribed. So a significant amount of gynecologists are already giving methylfolate, which is good. I would suggest that Fogsi actually makes this some kind of recommendation or guideline, that we do it all the time. And secondly, very important, as per WHO guidelines, to be given in the first trimester only. Okay. We believe that just because something is good, for 3 months, well, there's no harm in giving it for longer. But it is now becoming one of the reasons for autism. So I know it's a little complicated, but I'm just trying to make it as simple as I can. We have to
I got it.
we have to give it in the
It's a
right
good
form,
way.
which is the active form, the right dose, and for the right period.
Yes. Yes. So very informative. I mean, good information. I was getting, actually, when I read this, it was very confusing, and the same must have been with the other obstetricians, as you rightly said. So the good advice is that we have to shift to the methyl
Methylfolate, yes,
folate form,
methylfolate.
that is the active, and for the first 3 months when it is really necessary. Sir, may I ask you a personal question? You are
Yeah.
so passionate about these.
Mhm.
So what has been your journey into going into this field from the neurosurgeon to this field of autism, and how do you manage them?
So basically, it started when I was a student. I remember it was my internship. I remember the year 1983, 84, and I came across a patient who was sort of paralyzed in the ward, and uh, you know, he was a young man, had an accident, cervical spine injury, quadriplegic, just lying there. And I asked the RMO, why can't we do something to help him? So he said, no, he's got a permanent injury. He's going to either die or remain paralyzed for his whole life. So I asked him why. So he said, because the central nervous system cannot be repaired, once it is damaged. And when he was speaking this, the patient was hearing. Imagine you're a young 23, 24-year-old guy. He was you have a vehicular accident, you're paralyzed, and your doctor is saying either you're going to die or you're going to be paralyzed. And in that moment, my eyes met his eyes, and in that moment, I realized that my life will be about repairing the nervous system. And then I became a neurosurgeon, and I started working with spinal cord injury. I started working with other neurological diseases like motor neuron disease, muscular dystrophy. In those days, and when I started this in the late 90s, the incidence of autism was very low. As we started treating cerebral palsy, we then realized the benefits this has on the brain. And then slowly I got, involved in the field of autism because the results were very, very amazing. The results of our treatment are dramatic. A child who is not talking, who's not spoken for 7, 8 years, you do the treatment and he starts talking. There's no question about the improvement. A child who is not going to school starts reading and writing and going to school. A child who has incontinence of urine and stool, gets control. So the results are so, dramatic, and these children are very, very special and very wonderful. And the sort of amazing thing that has happened is as we are doing our research, into the brain, people focus on what these children cannot do. Our PET scans show that there is a part of the brain that's actually working more. And what we are finding is in a whole lot of these children, they have some exceptional abilities, special abilities. They can do things that we cannot even think of doing. And today, there is a sudden attention on this field. All these years, nobody even spoke about autism. But in the last 3 months, in three speeches, President Donald Trump has spoken about the increasing incidence of autism. In fact, in the Congress, he gave a talk where he spoke about the increasing incidence of autism. We know Elon Musk, one of the world's richest men, had autism as a child. He spoke about it. He was high functioning. He had Asperger's. Last month, Bill Gates, again, one of the richest men, actually in an interview to BBC, very clearly spoke that when he was a kid, he had all the symptoms that a child with autism would have. He wasn't diagnosed, but he had all the classic symptoms. We know that Albert Einstein had autism, and so did Leonardo da Vinci. So some of the greatest people, one of the greatest people who've shifted mankind from one level to another, have had some amount of ADHD or autism. So I am fascinated not by what they can't do, but I'm fascinated by what they can do. And our children, once they improve, have started doing the most miraculous things. I mean, unless, if I talk it, you'll not even believe that it's possible. You have to see these kids to see the miracles that happen, especially after we've given them cellular therapy.
So you are working for the rehabilitation also this is a very interesting thing that you said there are some centers who are working more hyperactivity is there, and so many examples which you have given, they're showing spatial ability. So, some rehabilitation or their development into those specific fields where they can excel can be done, of course, I think.
Absolutely. So, see, the brain is finally like a computer. A computer's got hardware and a computer's got software. Now, what we have shown the world, and we've shown the world for the first time, we have the world's first publication on this. By doing PET scans, we have shown the world what damage is there in the hardware. We've identified those areas, in particular the cerebellum. We all are familiar, the small brain that we call the cerebellum, the medial temporal. Some very important parts of the brain are completely hypermetabolic. They're just not working. And with our cellular therapy, we are able to repair this damage. We are able to make the inactive areas active. We are able to give function, because when we do our cellular therapy, what happens, and then we repeat the scan after 6 months, all the areas which were inactive become active. And this is a color scan. So the inactive hypometabolic areas are blue on the scan. The normal areas are white, and the areas working more are yellow and red. And 6 months later, you can see all that blue has become green, and that's one of the happiest, moments for the parents because they see objective improvement. However, you asked a very important question. What about rehabilitation? So, whereas we repair the hardware, this hardware needs software. And this software comes from two places. One is therapies, and secondly, from the family and parents. We are increasingly finding the role of the family to be extremely important. And earlier, interestingly, we always thought that management of autism is done by mothers. But to our surprise, what we have found is that when the fathers are proactive, when the fathers spend time with the children, when the fathers are actively involved, the kids tend to do better. So, our advice to families is for fathers to spend time with the children because we found that the results are dramatically different when the father is actively engaged. So, what is happening right now? You spoke about rehab. Right now, the parents are giving their children rehab. They're giving the best rehab to them, but they're doing it on damaged hardware. It's like if your leg was fractured and you just, did physiotherapy, would you be able to get results? No. But, if you went to an orthopedic surgeon, he fixed it, and then you did therapy, you would get better results. So
Yes.
presently, parents are giving rehab on damaged brain. So they're getting limited results. Once we fix the damage with our cellular therapy, now the same rehabilitation gives you much, much, much more and better results. And we are able to get a majority of the children. We have a 90% success rate. And we are able to get 90% of our children to go off the spectrum. And like I said, we've treated over 5,000 children, by the way, from over 100 countries, from over actually 103 countries. Children from 103 countries have come to us in India, to Navi Mumbai, to take the treatment. They've flown 15, 20 hours, long distances, because the results they're getting here, they aren't available anywhere else. So, yeah, it's very exciting. So that's an important question. Rehab is the software. Our cell therapy repairs the hardware.
Is the hardware or the medical treatment. There is the
Medical
cell therapy is the stem cell therapy, which is
stem cell therapy. Yeah.
about which you and even Dr. Sunita is working a lot on this. I mean, so really, it's very. We should be very hopeful for the parents on this. A very that usual question which comes to I think every gynecologist's mind whenever we talk of something new: is it very costly or it is affordable in India?
I
It is.
think I think as compared to costs of most other treatment, it's fairly affordable. It's not that expensive, and so and of course we have a provision where no patient has ever refused treatment, irrespective of their socioeconomic status. We have social workers. We help them. Getting funding to trust. We do a lot of work free of cost. Like, often children we treat free of cost, children from tribal areas, from rural areas, we don't charge anything. So, and yes, of course, you have patients who come to us from all over the world, and because they want a little better facilities to stay and all that, they pay for that. But nobody's ever refused for want of treatment, for want of money. Yeah.
Fantastic, fantastic. So you are doing I mean, great work for the community or as a whole, everything. And it's really lot to learn from you from this. Of course, the time is limited, so otherwise I would have liked to ask even more and more details. But still, the most important question comes here from the gynecologist and obstetrician point of view. What is our role? What is the possible? Is there prevention? Is there a treatment? Are the even I've heard some medical diseases can like control of hyperglycemia, control of hypertension during pregnancy, on which, of course, Foxy is focusing a great. They can all help, or what we should do more and what we can, how to
think
prevent it. That's the
that
main thing.
is the most important question. I think gynecologists as a group, if we just put together these simple things, could reduce significantly and drastically the incidence of autism. Like now, it is 1 in 36 today. You know, in 1995, it was some 1 in 1,000. Around the
Yeah.
year 2000, in 2000 it became like 1 in 100. By the way, this was after 1998 when WHO recommendations for folic acid came. It's also the time when mobile phones became more available. And then it kept on increasing. In 2005, it became 1 in 100. In 2015, it was 1 in 50. Today is 1 in 36. So the increase is very large. And the gynecologists, I would say, have the following role. First, like I said, the mother's emotional and physical health is extremely important with focus on emotional health. Because when a mother is stressed, there's release of adrenaline. We know that adrenaline causes vasoconstriction. And if there's vasoconstriction, there can be vasoconstriction to, the blood that's going to the child as well. So uh, we need to counsel the families, the husband, the in-laws, and emphasize on them that the mother's emotional health state is extremely important. That's why in our earlier traditions, normally in your first pregnancy, you went to your mother's house, because at your mother's house you're always the princess and looked after. So I think emotional health, diet, extremely important. Mothers have to be told, and one more major advice: the moment we know the mother is pregnant, to keep the mobile phones away at a distance. You can use the mobile, you can use Bluetooth, or you can use it from a distance, but not to keep the mobile phone close to you. Because if you keep the mobile phone close to you, that radiation can affect the fetus. So this is a very simple advice. I know it's difficult to implement in real life, but it's a simple advice that can actually prevent autism. So physical, mental care of the mother. Then again, avoiding smoking. We know for a fact that smoking during pregnancy causes, then, like you said, diabetes, various infections, torch, etc., depression. So these are some of the things that can predispose to autism. Also, the older age, in particular of the father. So it's found that a father who's between 25 and a father who's 45, the incidence is 3.5 times more. So more than the mother's age, actually, it's the father's age. So one should actually discourage, when the father is more than 40 to have children, because it's a 3.5 times increase. Then the next thing I mentioned is during birth. So, like, we found that more than 50% of our children have a history of some kind of hypoxia or difficulty in labor. So now that is something you can't prevent. I mean, no gynecologist would let that happen intentionally, just circumstances. But we need to be a little more aggressive, because here what we are finding is that the PET scans show that the posterior circulation territory is affected. All gynecologists are aware of cerebral palsy. They know that hypoxic ischemic injury causes cerebral palsy. That somehow affects the anterior circulation. That's why the frontal parietal lobes are affected. In cerebral palsy, you have motor deficits, you have spasticity, you have motor weakness, because the anterior circulation is affected. What we are finding now is that the posterior circulation, when it is affected, it can cause autism. So it's very, very important to prevent hypoxia during pregnancy. I know, I mean, nobody wants it to happen, but we need to have that
Yes.
little extra focus. And of course, folic acid supplementation. Like I said, please do not use the inactive or synthetic form. If you just did this one thing, instead of using the synthetic folic acid, use the methyl folate. Use it in the correct dosage. Don't just, we shouldn't use it just because it's there and we can give more and double. We are using infertility doses for normal mothers, and that is the thing we should not do. When WHO says zero point 0.4, we are using 5, zero point 0.4 milligrams, we are using 5. And again, only the first trimester. What happens under
Yes.
pressure from various sources, whatever, there's marketing, promotion, things just get pushed. So it's only the first trimester, and not after that. So if we did these things, we'll be able to reduce. And of course, once the if a child has autism, if the parents do come to you, because very often they're connected to you, a combination of treatments. What we believe is a full evaluation, including a brain scan, PET scan, MRI, EEG. We do a full blood evaluation. We are finding simple things. We are finding vitamin D levels are low in the majority of our kids. We are finding B12 is actually high, so we have to correct it. We are finding simple deficiencies that can be corrected at home itself in the children. We're also doing a lot of CSF studies, and what we have found is that there is a high level of glutamate in the blood, but a low level in the brain. We are finding that the dopamine levels are also low in both. So there's some very exciting research going on what is happening within the brain in the CSF itself. And then, of course, there's the gut microbiome. And finally, what we are now finding is that the earlier you treat the children, the better it is. So, children below 5, we have a 98.8% success rate. Children between 5 and 10, we have a 95% success rate. Children after 10, particularly after puberty, the results drop to 90%. So cellular therapy, the way we do it, basically because what we do is we, put a needle into the pelvic bone, anterior superior iliac spine, take out 15, take out bone marrow. It takes about 15 minutes. This bone marrow is taken to the laboratory, which is in the operation theater. We separate the mononuclear cells, the cells that we want, and then through a lumbar puncture, we inject it back. So the whole treatment has only 2 needle pricks. With one, we do the bone marrow aspiration. With one, we inject it back. Dr. Sunita herself does this, and she's got a wonderful experience with a whole lot of cases. Um, so it's a simple procedure. It's a very safe procedure because there's no surgical procedure. We're not cutting, stitching. There's no, big tubes, ICU, nothing like that. It's just 2 needle pricks. So it's simple. It's very safe. There are no major side effects, and we have a over 90% success rate. All our work is published, so we have right now 110 scientific papers on cellular therapy in neurological disorders, of which 16 are on autism, including the world's first publication on cell therapy in autism. So all our work is published in peer-reviewed journals. Our results are out there in the public domain. So the earlier we treat, the better it is. The whole problem is people, people have been advised to you keep on waiting, let us watch, let the treatment get more established. But the longer you wait, the lesser results we get. So the advice we give to everyone is that, do this, and we have to then combine it with rehab. So I think gynecologists have the single most important role in not just preventing autism, but even guiding our parents as to what to do once the child is diagnosed.
Thank you. Thank you. Fantastic, sir. I wish the conversation will not stop, but of course, the time is the limit. So I'll have to wrap it. And but as I wrap it, I would say it is a wonderful, informative podcast. And we should remember that autism children, they do need a different, valuable way of being human beings, and we should respect them. We should take care of them. We should early intervene them, and then we can definitely do something good for the. And very rightly you said, like the earlier we were told in our country there was a tradition कि अच्छा सोचो during pregnancy, अच्छी photographs lage. Everyone family was in a different scenario, pura like giving, which is in nuclear families is becoming difficult because of the so many pressures. So we should go back those traditions. They have their value, and we should take care of them. With this, I would say once again, special thanks to you, sir. And I'm sure that your work and your research more is continued, and more children are benefited. And a special thanks to our president, Dr. Sunita. She's working not only in this direction, she's also giving all the members, our committee chairpersons, unwavering support. And she has given this opportunity only. And because of that, we are talking today. So I'm thankful to my fellow obstetricians who have joined here, and the audience who has now seen this, or because this will be uploaded on the YouTube, they will further be. So the conversation should go on, and I'm sure, sir, your website and the Instagram and other social media platform, you will be giving more and more information. So I would tell them to be more curious, stay kind, stay open. Until the next time we meet again for some other podcasts.
Thank
So
you.
thank you
Thank
very
you so
much,
much.
sir, for
Thank
giving
you.
fantastic information. Thank
Thank
you.